What I do know about pain is that the pain and the emotion centers are wired next to each other in our brains.
Yeah.
So, and this is for a good reason from an evolutionary perspective. If our ancestors almost fell off a cliff, they became afraid of cliffs and we survived till today.
Which is why we're still here.
Right. So thank goodness we were wired this way.
For pain.
The caveat of that is we cannot have a physical injury without a mental, emotional injury that goes along with it. Mm-hmm. There may be anxiety, depression, post-traumatic stress, as well as the process of mourning that goes along with losing something. So when I talk about pain, I talk about it as like, it's like those orange cones on the freeway. It says, don't drive here right now. Doesn't mean forever, but that's a construction zone at the moment. You could drive through there and it might be okay. You might get away with it. But in general, you're kind of asking for trouble. So for now, drive around. Later on, you go through, it'll be beautiful. The freeway will be fixed. You'll drive right through. But for now, I want you to know what hurts and don't do it. For every $1 we spend on ibuprofen, we spend 80 cents on stomach bleeding, kidney failure, and heart attacks. Okay. So, by the way, inflammation is part of the healing process. And as I mentioned earlier, rowing doesn't make you stronger. It's the recovery from rowing that makes you stronger and better. So, and part of that recovery is the inflammatory process of tissues that you've broken down and the reparative process that goes on then. That's what makes us stronger. So, not only does things like ibuprofen turn down your pain biofeedback, doesn't allow you to do rule number 1, if it hurts, don't do it. It also stops the healing inflammation and may interfere with the reparative process. And there's also studies that have shown that, I don't have a source for you, but reducing pain by itself decreases healing, which kind of makes sense from a biologic, evolutionary perspective, because pain is there for a reason. Mm-hmm. The body has like a natural cast that it built when you injured it. What does it do? It swells, it fills with blood, which has things like stem cells, and the whole inflammatory cascade goes in, where things like macrophages will eat up the loose tissue, and then things will scar down into functional range of motion. So use it or lose it. Back when we were the cave people chasing the woolly mammoth, we got injured, we couldn't just sit down and rest. We had to keep going, or we would starve or be eaten. Mm-hmm. So we had to keep using it. Never before did we have this opportunity to rest so much. And if you rest too much, I believe that things will scar down in a non-functional range of motion. But if we keep active, just following the 3 rules, if it hurts, don't do it. If it hurts more the next day, that was too much, and no more than 10% increase per week, then things can have a chance to have the healing inflammation go in, clean up the area, and then having scar down in a functional range of motion. When we have pain in an area, the muscles turn off through pain inhibition, and it swells up, which is kind of like a natural cast. It's the smartest cast, probably smarter than anything we could design. And as you need it less,
a few thousand years to develop.
Oh, and
process.
There's been life on Earth for 4 billion years now. And what I know about my studies of natural selection is nature does not waste energy on processes that don't, at some point for some person, convey a selection advantage. So whatever our bodies are doing, even if we're not smart enough as doctors to know exactly what it's doing or why, my default is to trust that the body's doing something on purpose that at some point, sometime, conveyed a selection advantage for somebody and help them survive, and to support the body in what it's doing, as opposed to trying to fight it with things like anti-inflammatory drugs or steroids or so many of the interventions we're doing.
I want to come back to what you were talking about with if it hurts, don't do it.
Yeah.
Because pain is subjective.
Right.
Right? And so, and depending on somebody's history with pain and their emotional response to pain, how they watched their family respond to pain, that is what crafts their understanding of what they're supposed to do and how they're supposed to respond. So when you're saying that, they may come back to you a couple weeks later when you're checking in on them, and I feel like you could see across the board, and I see this in my clinic.
Yeah.
You said if it hurts, don't do it. Well,
sure.
I put my feet up, I've done nothing, and it still hurts.
Right.
So does it stop there, or do you get a little more into trying to qualify or quantify the if it hurts, don't do it?
It certainly needs to be individualized, because I believe that there can be intergenerational pain and pain memory from experiences that have been had by your parents and grandparents, and certain responses to trauma that can be actually passed on and learned by subsequent generations. So I believe in intergenerational pain. And I believe there are cultural differences in pain. And yeah, I mean, if you look at the emotional milieu or environment in which pain lives, like the pain of winning a rowing race is much different than the pain of my knee is degenerating. So the so the emotional context of what the pain means plays a big role in how it's perceived. And like back when I was, a surgical intern working on the burn unit, someone would have pain and we give them opioids after more opioids and more opioids. And it wasn't until we treated their anxiety that we didn't even need all those opioids. So the mental emotional process that was going along with the pain was really a key component.